you can't speak to your loved one who's going through the process and tell them how you feel sometimes. But having an objective person who can listen to you and you can bounce things off, I think, is probably the most important.
Welcome to Baptist Health Talk, a podcast on all things healthcare, powered by Baptist Health South Florida, your trusted source for healthcare prevention and wellness.
Hi, everyone. I'm your host, Johanna Gomez. Welcome back to a new episode of Baptist Health Talk, where we answer your most searched questions on trending topics. Today, we're talking about the journey of being a caregiver to a brain cancer patient. We're here to talk through the real stuff, what it's like, what can help, and how you can support your loved one. We're joined by Dr. Yazmin Odia, Neuro-Oncologist at Baptist Health, and Martin Hiriart, who has been caring for his beautiful lovely wife, Sylvia. Thank you both for being here. Definitely not an easy journey, but the fact that I see you sitting there with a smile just really gives me a boost of optimism for what you guys have gone through and what you will continue to go through, because this is obviously something that affects you for the rest of your life. So thank you both for being here and talking about something so serious. Your wife, Sylvia, was diagnosed last year with brain cancer. That is definitely a shift from being a husband to being a husband to a caregiver. How has that been like for you?
Well, thanks, Joanna, for having me here and helping us, allowing us to share our story.
Yeah.
I consider myself a caretaker for Sylvia for the last 36 years since we've known each other. You know, we made our wedding vows. It was to take care of each other. So the only transition has been in the way. We take care of each other. I take care of her now. I have to be a little bit more attentive, remind her of some things that she tends to forget that she didn't before. A lot more appointments, for sure. A lot more doctor's appointments and tests that we have to do together. And have to rearrange my work schedule, obviously, to be able to do that. But she obviously is number one priority. So that was the easy part to do that. That was really not too much thought had to be put into that. But really, aside from being a little bit more organized than I have to be as far as my time management. Sylvia's made it really easy. She's doing, thank God, very well. So that's made it a little bit easier so far in our journey.
Yeah. Well, it sounds like you are an amazing human just by that. Dr. Odia, I'm going to ask you because I am curious. We all know that obviously it's a very scary diagnosis once someone hears that. What can caregivers expect with their loved ones and that initial diagnosis, that shock moment that people feel?
Well, as I share the diagnosis with patients and family, I always have to remind myself that patients are at different stages and their caregivers also experience the process differently. And so to be able to meet the patient and the caregiver where they are is very important because patients will basically get a shock diagnosis, an altering diagnosis. And the next things that happen varies by patient and by caregiver. They'll go through griefs, they'll go through anxiety, denial, they'll go through bargaining, they'll go through the full stages of grief, but they may not be at the same pace with each other. And so trying to find out where the patient is, where the caregiver is a very dynamic process. And what I've learned as a physician is that takes art. That's not science. That's the art of medicine. And so being able to meet patients, and I believe that the caregivers also have to understand that whatever their experience is legitimate and it's fair, but to also understand that their patient, their
loved ones,
their loved ones may not be at the same page. So I think that that's important.
Does it get easier? I'm assuming that it doesn't, but does it get easier for you to say that initial, like, it is cancer?
It's always hard because, well, if I didn't have compassion still, I would say it'd be time to move on. So I share in the moment with them. But what I do understand and what I've set as a moral standard is that I try not to lie, but I try to understand. So I try to deliver the information in the most compassionate way. I always say, how would I want a loved one to hear this? And so that's how I share it. So I think it's very important to be truthful, but be caring in every way that you share information.
Yeah. Martin, how important was it for you guys to have that perfect care team when it comes to knowing that you needed to make sure they were backing you up and you can have that kind of relief when it comes to your state of mind, that they were doing the right thing to guide you towards where you needed to be?
Oh, it was very important, not only for myself, but seeing that Sylvia felt comfortable with her team meant everything. When you have the choice nowadays to go anywhere, the fact that she felt comfortable with her team here at Baptist, that's where we stay. From day one when she met her surgeon, Dr. Seelman, to Dr. Odia, Dr. Chen, all the support staff, nurse practitioners, MAs, etc. I don't want to leave anybody out. They all have been amazing. But, she feels, I can't leave Dr. Kotech out either. But all the physicians and staff involved have been very caring, very understanding, very supportive, not only to her, but to me as well as a caregiver. I'm included in their, and when they're taking care of Sylvia. And when I'm not there, they look for me, to see where I am. So I think the fact that they include the caretaker also as part of the caring for the patient, I think is very important, that person is not just pushed to the side while they take care of the patient, but they were also brought in to help and to be part of the decision process and part of the information that's given.
Yeah, I see you nodding in Dr. Odia with Martin. So you're agreeing. How important is it, though? And what should caregivers kind of keep in mind? Because your day-to-day life changes, and that's the reality. It doesn't look the same.
And that's true, but it's not a steady, linear progression. What patients experience and what we as providers experience is ebbs and flows.
Yeah.
You have high moments where there are great successes, and we celebrate each and every one. And I think that's one thing I've learned even as a provider, just to enjoy what's good in today. And so if we have a good MRI result, it's a good thing to celebrate.
Yeah.
If there's an option that sounds interesting, then it's a good thing to celebrate. But it does take a holistic approach. You can't just see the science of it. Oh, this is a treatment modality and this is another, or a trial, or, a standard of care option. But rather, how will you feel through the process, and explain that as well. What's the experience?
Well, the thing is that we know that it changes, right? You can expect one thing, but we know that with cancer, you say, this is what we think is going to happen, and then something else happens and it changes. So what do you say to them to kind of keep calm as time goes on, but the disease might progress at that moment?
That is the difficult journey we take patients through. So when there is the unexpected, or the unexpected MRI, the progression on the MRI, we try to explain it first. This is what we see. These are the options. These are what to expect. And I think, at least my experience as a provider is, I have learned that patients sometimes suffer more in the anxiety than not knowing what happens next. So I do actually take time to explain, what do you expect from this treatment? What should you expect from this? So that they can understand and have a visualization. And I find that once they're actually on the progress or on a treatment plan, you can actually see nerves calm down.
Yeah.
And the same thing, I think, for the caregivers, the anxiety of not knowing.
Yeah, it's there. That's true. What treatment plan was Sylvia on, Martin, and how did it go for her?
Sylvia first started off with surgery, and that went very well. She was actually out of the hospital within a couple of days, and everybody was pretty amazed at how well she did. And then she went to the standard of care for this type of cancer, which is a chemotherapeutic agent called Temodar, and radiation. And she did well with that. She did that for the first 30 sessions of radiation and chemotherapy. And then after that, there looked to be some progression, possibly. And she was having some type of reaction to the higher doses of the chemotherapy. So that had to be discontinued. And she eventually ended up needing a second surgery to see what was going on in that area of concern. And she also did very well with that one, though she did have a little numbness in the right side of her face from that surgery. But overall, considering possibilities, that was minor. And then she has done some more radiation and has participated in some clinical trials. And thank God so far she's doing well.
Yeah, thank God for that. She is your patient. So can you explain to us, because there's obviously different types of cancers. Sylvia is glioblastoma. What's the difference between that one and other cancers, brain cancers?
So glioblastoma is different in many others by two distinct features.
Okay.
One, it's primary, which means that it was born of the brain substance itself. The more common scenario is that it's metastatic. It came from a lung or a breast.
Right.
That's the most common type of brain cancer. In terms of brain tumors, the more common types are benign meningiomas. You can remove them. They're completely curable. With glioblastoma, because it's born of the substance, it integrates into the same brain substance. It's also malignant, cancerous, and it tends to grow back. And so that's a huge hallmark of glioblastoma. It isn't a one and done, and it doesn't go anywhere else. But it affects the different parts of the brain depending on where it is. And so there's a lot of changes in function or language that can happen with patients. And so the course is very different for every patient, depending on where the disease is.
Right. Okay. So my first thing that I thought of when you said that was, what can I do to avoid to not get it? Is there anything?
You know, it's sad that in the great majority, about 95% of patients, we don't know why they got it. In fact, many tend to be healthy. So there's only about 5% of patients that either had radiation exposure, things like a nuclear accident or, radiation as a child. For those patients, we kind of know.
Right.
There's even a smaller fragment of patients that have genetic syndromes to predispose it. But the great majority, there's not a screening test. There's not a preventive measure. We don't even know what caused it in the majority of patients.
Do you think that is something that will change throughout the future as science and technology continues to evolve?
I think one of the difficult things is that as like most diseases, there's multiple reasons why patients have it. There's probably some predisposition, and maybe we'll gain more understanding into these. Hopefully, we'll get better understanding into the process itself to be able to treat it specific to the patient.
Right.
And I'm hopeful that that's where medicine is going.
Yeah, I hope so too. How did you find the strength? We talk a lot about this, and it is hard. It's hard for the patient, but it is extremely hard for the caregiver. And I think you said it best in the beginning. You were like, everything was about Sylvia. She is number one. We need to make sure she was number one. And sometimes caregivers are on the bottom of the list when it comes to things to get done. Where's your state of mind? How are you feeling? And where did you find the strength?
Well, we gather our strength from our faith. Yeah. Really, we're our faith in Jesus Christ has really guided us through this. Has given us the strength, the peace that we've needed to go through this, navigate this path. Without that, I think we'd be in shambles, really. And then we have obviously our close family and our support group, not only close friends, church members, and even I have coworkers and patients that pray for us, and even they may not know Sylvia, but they know me or they heard about her, and they offer their support through prayer. Yeah. So I think that amount of support, in addition to obviously the support from our medical team, I think that's what gets us through it day by day. And I think as Dr. Odia said also, it's a day to day, celebrating the small things, the good things that happen. I think that helps us, and I've continued planning our life.
I love that.
I haven't. She gets upset sometimes that why are you doing this? That you don't know how I'm going to feel. But I think it's important for both of us that we keep our lives as normal as possible for our mental state. So we have a trip planned to see our grandkids that are out of town. We have a trip to Italy coming up, hopefully in September, that she's always wanted to go. And I think as much as we can, I think that's what keeps us going.
Oh, I love your approach to this. And I think she's in great hands. Obviously, she really is. Dr. Odia, when it comes to this, there's memory loss, there's mobility loss, there's obviously a lot of changes that take place. What advice do you have for caregivers to keep an eye on so they can help their loved one through this process?
I do think that you have to, as Martin said, be a little attentive to note changes, because sometimes if we catch symptoms early, we can intervene sooner. We can provide additional services. It's amazing what a complete holistic care team can really help. We have phenomenal rehabilitation services. We have a great social support, social worker, nurse navigators, and we try to take advantage of all of that to make the process easier. Yeah. But as I said earlier, the process is very different for patients. So one of the common questions, in fact, I do get asked by patients or caregivers is, what do we expect next? And that question can't be answered generically.
That's a loaded one.
That's correct. And so often I have to take the patient, I have to see where the tumor is, where it is progressing, to be able to detail precisely for them what to expect. And so there's not a generic answer to that. It is patient specific. The journey is unique for most.
Okay, so Martin, what's your advice for caregivers? Someone is facing this right now, starting in this journey, in the middle of it, and is feeling a little lost. What advice would you have for them that are watching right now?
I think to never lose hope. Make sure you develop a good support system, not only for your loved one going through the process, but for yourself. Someone you can go and talk to, that you can vent your emotions, vent your feelings to, and sort of, even if they can't do anything but listen, I think that's, because you can't speak to your loved one who's going through the process and tell them how you feel sometimes, but having an objective person who can listen to you and you can bounce things off, I think, is probably the most important.
Yeah, and I don't think that we say that enough, and we speak about it enough, that it's okay to have a support system and someone to talk to. It's okay, because you are going to have those days that are just filled with so many roller coasters. There'll be good days and bad days. Would you continue to emphasize to your clients, to your patients, how important it is to have emotional support system, logistically, a team involved with getting through this, and the importance of having it early on in this process?
Absolutely. I actually try to address that early with many caregivers. Yeah. It's impressive. You really get to know who your closest friends are when you go through this.
Say that again.
Because there's sometimes some unfortunate souls that don't have a Martin in their family. A caregiver, a husband, a spouse, a family member, but you end up having some really good close friends. And what I emphasize to all is that the caregiver has to find a way to care for themselves too. And that's because they too, as I mentioned earlier, will go through grieving. And so they do need that support system around them. It is phenomenal when you see it working well, like in Martin's case, where you can truly see they have an army behind them supporting them. It's important. And I think that it's important for the patient, but it's certainly very important for the caregiver, especially as the process goes on. Often the caregiver is far more aware than the patient. And so it's the caregiver that needs the maximal support.
I agree with you. And we forget about that a lot. We forget about the caregiver needing all that love and attention and that support. So if there's something that you wish you would have known, what is it?
Probably how, in most diseases, you have a straight path and you know what to expect. Yeah. As Dr. Odia was saying, in this particular cancer, you really don't. So I guess prepare for the unexpected is be willing to adapt and to change strategies and what you're going to do. I guess would be the best thing is, always be prepared for the unexpected, because you don't know. And I think also, live day by day, enjoy your day. Every day is a blessing. And don't look too much farther than that. And I think that's probably advice for all of us, with or without a cancer diagnosis.
Absolutely.
We don't tend to do that enough, I think. None of us have tomorrow guaranteed. So I think probably we should enjoy each other more every day.
That's beautiful advice that we all can agree on, that we should take on in our life. Would you like to add to that advice or any resources that caregivers should be aware of?
I think Martin hit it right on the nail. I do think that I, even as a physician, have learned to appreciate each and every day. I appreciate my family more. And they've taught me that. The caregivers and the patients have taught me that when you realize to prioritize things in a different structure, when you realize that life is finite and you see it every day. But I celebrate, and I've learned that even from my own staff, my APPs. I've never seen a division that celebrates everything so much like they do. And I think it's because they also see the flip side. So they realize today is precious.
Yeah. Martin, I'm assuming that you learned a couple of things too about your lovely wife that you didn't know about her as this was going on, how she tackled this. What have you learned about her that you were most shocked about?
Well, I always knew she was a strong person, but now even more amazed by her. She just has a strength that I don't know if I'd have if roles were switched, being honest. She's amazing. She's always with a smile, very positive. Even from day one, she tells all her caretakers she's going to be a long-term survivor. And
I love that.
And challenges them to make that happen. And I think she has a very positive attitude, and nothing gets her down. And she's always looking to make people around her, brighten up. Yeah. And joke at the beginning, she was joking about her MRI, the appearance of her MRI.
What did she say?
Well, I don't have the picture with me, but the initial MRI, the tumor looked like a little fetus. Okay. So she was joking about how she had a fetus in her brain, and then the nurses were like, the nurse on the floor didn't understand what she was talking about, so she showed them the picture. But she was the first time she was in the hospital, she had a lot of young nurses. Yeah. And I think her, not making light of it, don't get me wrong, it wasn't she was, making light of the situation, but the fact that she approached it with such strength and resolve impressed the young nurses there. And they're like, wow, if you can approach this type of situation like that, then, that's teaching me something, how I need to approach situations in life. And I think that's one of Sylvia's approaches, is I can still help people. I can still teach people about life, about God, about faith through what I'm going through. And I think that's her approach. This is her new, as she calls it, this is her new mission field. We used to be missionaries. Yeah. Now we can't travel as much, but so she's okay. So the hospital's my new mission field now.
Safe to say that you're doing it now, right here with this conversation.
Yeah. So that's the way we look at it. That's the way she looks at it. And she's like, God gave me this for whatever purpose. And I don't know what it is, but I'm going to fulfill it. And I think I get some of my strength from her, watching her deal with it.
Yeah, you feed off of each other. I will continue praying for Sylvia and for you. She is in great hands, obviously, for a lot of reasons, but we will send you prayers.
Thank you.
Thank you so much for both of you for having such a wonderful conversation, sharing your story. I know that it's pretty tough to share with a lot of people what you're going through, but you really are helping so many, and it is important. So thank you to both of you for being here. And to our viewers, be sure to hit that subscribe button on our channel here to keep up with the latest health and wellness information and tips from our experts. Thank you so much for watching.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Baptist Health Talk is brought to you by Baptist Health, the warmer side of care.